I'm Saul Garza with the City of Garland's Media Relations Department. Joining me this morning is Jason Cheshire, the Managing Health Director for the City of Garland, as well as Diana Beeler, the Health Administrator here. And today we will be talking the COVID-19 vaccine because, well, that's what a lot of folks are talking about right now. Jason, we have brand new information that you want to share with folks. But first, let's start off with the latest numbers. Nationwide, those numbers have not gone down. And here in Garland, they have not either. So tell us the latest numbers. You just got some this morning.
So these numbers are actually, as of today, and they're the most up-to-date numbers that we have. Our website will soon be updated with these numbers. So the total number of positive cases as of today is 15,631. So we added 231 cases today. To break that down, 3,498 of those cases are considered active. So those are people that have been infected and have not yet met the end of their isolation or quarantine period. That represents about 22% of the active cases. We have about 12,010 of those individuals have recovered. So they've become infected, they've met the end of monitoring criteria, and they are presumably back to normal life. That represents about 77% of the total caseload. And then unfortunately we have 123 deaths. So there have been 2 deaths added since yesterday, and again that number will soon be updated on our city webpage. That represents about 0.8% of the total number of infected individuals. And just to give you an idea, the percentage of Garland population that has been infected by COVID from the beginning of the pandemic until today is about 6.4%. So that works out to about 1 in every 17 Garland residents has been infected by COVID-19.
A big number there, and we do have some. And you guys, I thought I was done with covering breaking news, but we did get breaking news this morning. I mean, just a couple of hours ago. You got new information. In fact, you didn't really have time to send the word out, if you will, to some folks, and so because we've been preparing for this, and so it's confirmation that we're getting several hundred doses of the vaccine.
Yeah, so it's a kind of a coincidence that we're having this Facebook Live video. We'd planned this, as you said, for several days, and the anticipation was to provide up-to-date information on what we know about the vaccine. Well, late yesterday, we received word that the City of Garland will receive 900 doses of the Moderna vaccine. So that's absolutely great news, and I got to tell you, although we have been preparing to receive vaccines for several months, I'm surprised that we've gotten them this early. I'm pleasantly surprised that we've gotten them this early.
I don't know if I've heard other cities, or Dallas County, have we heard about anybody else getting them?
I have not. I think we have one provider in Garland.
One provider that I'm aware of in Garland, but as far as other cities, I've not heard.
All right, so folks are going to ask, and we want to mention if you all have any questions, let us know. Write your question down, and we'll try to answer it for you. But folks are wondering, okay, so 900. Okay, so who's going to get them first? How will you work that out? Can I sign up and all those questions? So yeah, how are you determining who will get them first?
Great questions, all of them. So the prioritization for vaccines has been set by the state health department, the Department of State Health Services, and we and every other jurisdiction and provider are going to follow that list of prioritization. So for the initial doses, the priority group is healthcare workers, which if you think about it, it makes sense because these are the individuals that are providing care and will presumably be providing immunizations, but right now they're providing care for individuals that are infected with COVID. So those are the ones that we want to protect first. And when I say healthcare workers, that includes hospital staff. It includes staff in long-term care facilities. It includes the fire, paramedics, and EMS folks that transport sick people to the hospital. It includes home health care workers, hospice workers, and the like. And it also includes residents of long-term care facilities. So that group, those 5 groups that I mentioned will be the ones to receive these first 900 doses. And the good news is that if, we're going to rapidly administer these 900 doses. We've got a plan in place. We've already talked with our fire chiefs. And the more quickly we administer those doses, the more doses will be made available to the city of Garland. So we are in a race for time. As soon as the vaccines have been allocated to us, they've not yet been delivered. We're told they'll be delivered next week. I don't have a date, but next week of Christmas. And we're making plans to immediately administer those vaccines.
And now those 900, though, will it be enough to cover all these folks you mentioned?
No, it'll be, obviously it'll cover a portion of them. And of course, the goal is to get those vaccines in the arms of these individuals as quickly as possible. And then we'll be able to receive more vaccine to completely cover the first tier group, which, then we'll be able to expand the availability to, the folks over 65, the high-risk individuals. So the quicker we can vaccinate people with these vaccines and use them up, the better off our community is, because we'll have more vaccines available to more people.
What about the Pfizer vaccine? What have you heard? As we know, those have already been going out, been distributed across the country, and even administered as well. What's the latest on that in terms of, if Garland's getting some of those?
We've not had any indication that we will be receiving any Pfizer vaccines, at least yet. Now, that certainly doesn't mean that we won't get Pfizer vaccines in the near future. But initially, as you said, the Pfizer vaccines distribution began directly to hospitals and long-term care facilities last week. So, and at that time, Pfizer was the only vaccine with an emergency authorization. So, it seems like the bulk of the Pfizer vaccines have gone to those facilities. Of course, the Moderna hasn't even received emergency authorization, but that's forthcoming in the next few days, which is why we've been given an allocation and why it'll be shipped to us next week. The Pfizer vaccine, of course, everybody's probably heard that it poses some logistical challenges in terms of storage. It requires ultra-cold storage, which is negative 70 degrees Celsius, which is a challenge, and it can only be at room temperature for a very short time. We've been making preparations, and if we get Pfizer vaccines, we have the preparations in place to be able to safely store it and rapidly administer it. But it was a pleasant surprise to get the Moderna vaccine because it does not require ultra-cold storage. Much easier to store and handle.
Yeah, and I will tell folks, behind the scenes, you all, health department, school district, fire department, police department, the cities of Saxe and Rowlett. You all constantly are talking. I'd be curious to see what your calendar looks like, because I'm sure it says Zoom meetings all the time, because you all are always just talking. But one of the things, you all are not only talk, but also, discuss and plan and coordinate and share, ideas and plans and what have you. If one says, hey, I need this, you all are quick to, so that's what's happening, folks, behind the scenes that you all may not know, is that there's a lot of planning going on, and there's a lot of discussions going on how we're going to do it and how will it work. And so, let's...
If I may, I'm sorry to interrupt, but if I may, I appreciate you mentioning that, because many residents may not know that the Garland Health Authority, Dr. Tim Lambert, has been appointed as the health authority for Garland, appointed by the city council as the health authority for Garland, and the same thing has happened for the cities of Saxe and Rowlett. So he is the common health authority for all 3 cities. And if you're a resident of Garland, you may ask, well, why is that? Well, it's because of the Garland Independent School District and their open, what do they call it?
Open enrollment.
Open enrollment program. Mm-hmm. So kiddos in Garland may go to GISD schools in Rowlett or Saxe and vice versa. So long before anybody ever thought about COVID, to make it easier and more efficient to investigate and prevent disease spread, particularly in schools, those 3 jurisdictions adopted Dr. Lambert. And it's worked out well with COVID because, as you said, we're working hand in hand with the fire departments, health departments, police departments from Garland, Rowlett, and Saxe, as well as GISD. And I think that relationship, that Tri-City Health Department, is going to bear fruit as we roll out the vaccination process.
And the Garland Health Department is unique in that it operates under its own, on its own, really. I mean, yes, you do talk to the Dallas County Health Department, but I mean, you all, operate and make decisions, primarily, on your own and deal with those residents that you just mentioned. And we should mention that, Saxe and Rowlett residents, this also applies to them.
Correct.
Yes.
Yeah.
Yes, as I mentioned, the city councils of all 3 jurisdictions have appointed Dr. Lambert as their health authority, and that is a process outlined in state law. So he is the health authority for those jurisdictions, just as Dr. Wang is the health authority for Dallas County, exclusive of Garland, Rowlett, and Saxe. The county commissioners appointed him through the same process that our city council appointed Dr. Lambert. So we are a bit unique. There are very few municipalities that have appointed their own health authority. I think. I would like to think that our city administration and perhaps even city council would, I think COVID has probably made all of those folks realize how valuable it is to have a municipal health department in these times because they're able to get real-time information. We're able to tell them exactly how many Garland residents are infected with COVID and how many have recovered, whereas municipalities without health departments who've not designated their own health authority find it difficult to come up with that information.
But it's not to say you don't talk to Dallas County Health.
Correct.
You are always talking to them and working with them. Yeah.
We work hand in hand with Dallas County. We've got a great relationship. Talk to them, if not on a daily basis, certainly several times a week.
All right, we've got some questions right now on Facebook here let's start off with Dorothy. She's asking, when the high at-risk public, they're able and in line to receive vaccines, what documentation is going to be required as proof, and will there be no delay or difficulty in getting that documentation? And I guess, and before we answer that, I guess how will it work in terms of, okay, you do the first responders and those first, and then who's next?
Well, so the state has several tiers of what are considered healthcare worker definitions. There's actually 2 tiers of healthcare worker definitions. The next tier, I described the first tier a few minutes ago. So the next tier are staff in outpatient offices. Those are going to be like your family doctor or folks in freestanding emergency medical care facilities. So the freestanding ERs that you've seen pop up over the past few years, pharmacy staff, public health staff that are actually providing vaccine, school nurses. So those are folks that are in tier 2. Which are still considered healthcare workers. Once healthcare workers have been vaccinated, then you move to the high-risk public. So the high-risk public are going to be those folks that are over 65 or the folks with underlying medical conditions. And to get to the specific question that Dorothy asked, we're not going to tie up the process by requiring a high burden of proof if an individual fits within those categories. I mean, our goal is to vaccinate as many people as quickly as possible. We're going to do the basic checks like, a company ID if you're a healthcare worker. But we're not gonna go through a long audit process to determine whether or not you get the vaccine. In a sense, it's going to rely on the honor system, and we're gonna expect folks to tell the truth and to wait their turn, knowing that we're going to get to them as soon as we possibly can.
Yeah, we had a question from next door also saying, my wife and I are over 70. My wife has diabetes. We're staying at home because of the pandemic. So will we get vaccinated at home?
Great question. We won't vaccinate people at home, but the plan that we have in place is to do a drive-through vaccine. So it's tough to ask a large group of people to come into a building and maintain social distance. And we still want to maintain social distance because the vaccine has not been widely available yet. So we have a plan for a drive-through vaccine. So folks like those individuals will be asked to get in their car at the appropriate time when the vaccine is available for that group. They'll be asked to drive to a specific location, and they will receive the vaccine while they're sitting in their car.
Okay.
And we have actually tested that process. We had a flu vaccination clinic for city staff. We tested the drive-through process. It worked great. And we know that we can vaccinate a substantial number of people, upwards of 1,000 people for even a small-scale drive-through event. We know that it works, and that is the model that we intend to use to widely distribute the vaccine when it's available.
Do we know where? Has that been determined? Or
We
announced?
have locations. We're looking at locations. We have a location in Garland. We have a couple of locations in Garland, and we're also looking at locations in Rowlett and Saxe because we serve their residents as well. And so the Rowlett and Saxe fire departments and their health departments will assist in staffing, vaccine events in their cities, and the Garland Health Department, Garland Fire Department, Garland Police Department will staff the vaccine events in Garland.
And we should also mention that, things change really from not week to week. Day to day. We've seen
Hour
the past
to
few hour to hour. The past few months you can say one thing one day and then the things change, and everybody has had to adjust to COVID. We all have had to. So one thing that folks should consider and keep in mind that we're saying this now and we are making plans for this, but those things could quickly change. But of course, we are updating folks accordingly and online and social media and website and what have you to those latest changes. Somebody else asking, all right, so can I sign up to get the vaccine?
Yes. Well, not yet. Let me back up. We don't have a program in place to sign up just yet. What we do have is our IT department is at the very final stages of developing a platform where folks can sign up when vaccine is available to their demographic group. So, for instance, the individual that asked about the folks that were 70 years old. Mm-hmm. When vaccines are available to those that are 65 and older, we will have a link on our webpage for individuals to sign up. And that sign up will actually limit the number of people that sign up during each hour that the clinic is open, so that we're not overwhelmed, so that the wait time is manageable. And that's the way that we intend to roll this vaccine out, so that you don't have to worry about fighting for a spot in line. You sign up online. If you're not able to sign up online, we'll have a phone number where you can call and sign up. And then you have your time slots, you have your hour that you can show up anytime during that hour, and you'll get your vaccine.
Yeah, in fact, hopefully that answers Ana Maria's question there, saying that she and her husband, 89, 82, we are not in a nursing home, and asking when and where we'll be able to get our shot. So,
and I think Diana.
I also want to mention that there's, upwards of 40 providers in the application process to receive the COVID vaccine. So, always talk to your provider to see if they are applying to get the COVID vaccine. So there's a good chance they will be receiving it, and they can actually get it at their doctor's office.
Yeah, so it won't necessarily all be coming from the city.
Right.
That's an excellent point.
Yeah.
Yeah, there are going to be many places besides the Garland Health Department to get the vaccine. And as Diana mentioned, the web page that lists all of those providers, we're actually going to link to that on our web page if we don't already have that link there. It's available, and individuals can go and look that list up. It's listed by city, by county, by city, and they can see if there are providers there. Pharmacies are online, and there'll be providers when vaccines made available to them. Great point for Diana to bring up, and I'd like to reiterate, folks need to know that they don't have to get vaccinated through the health department. There's going to be many providers in jurisdictions throughout the state. We are one of many, and we're going to serve our public as best we can, but we're certainly not the only place that you'll be able to get a COVID vaccine.
And with that being said, though, I'm sure that it's going to pop up somebody advertising, they see a flyer, what have you, saying, hey, the vaccine is available here, or I can get it for you for $19.99, or whatever the case may be. But what should folks look out for in terms of when they think it may be fraud or somebody, not on the up and up, and what should they do?
It's another absolutely great question, and my response would be to check the state webpage that's linked to our website, or that's linked on our website. And if your provider is not listed on that webpage, or the individual advertising COVID vaccine, if they're not listed on that webpage, I wouldn't go to them.
Right.
Just stay away.
Stay away. Stay away.
Yeah.
Only the folks that are listed on the state webpage as COVID-19 providers, those are the only doctors or pharmacists or businesses that you should seek vaccine from.
Because, we're bound to see those, somebody knocking door to door, or, hey, and people wanting that vaccine, they can't get on the list, or they're way down on the list. They're going to think, hey, I can get it here cheap. And speaking of, when the vaccine is available, do folks have to pay?
There's no out-of-pocket cost. Folks with insurance, their insurance will cover a portion of the vaccine, but nobody will be asked to pay money out of pocket to get a COVID vaccine.
Joshua Garcia asking, are teachers considered frontline first responders?
Teachers and Diana?
I think they're going to be in phase 2.
Okay.
They're not considered frontline first responders.
So they're going to be in a similar priority group to the high-risk individuals.
Okay.
I'm sorry, as you can imagine, it's hard to remember all the information.
That's all right. And we should tell folks, some of the things, you may not necessarily know right now. Like we said, things are changing, and we're here to provide as much information that we currently do know to folks out there right now. All right. So,
I was just saying, the fact is the vaccines are here, they're coming quickly, so hopefully this staging of who gets what won't last very long, and it's just going to be available because they're coming. They're ready to really start sending them out. So the more we get in the arms, the more vaccines we're going to get, and it's going to quickly, everybody's going to have access, I think, pretty quickly.
Yeah, and so let me look at another question from next door. Somebody was asking whether the vaccine, whether it be Pfizer or Moderna, guard us against all forms of COVID-19. It seems like there are different sets of symptoms described in the West Coast, East Coast, which includes a very persistent cough. So I guess who will it cover and how effective, I guess?
Yes, that's another excellent question. There are, I know that there is specific literature on the CDC webpage pertaining to that, but generally speaking, the vaccines, at least the Pfizer and Moderna vaccines, those vaccines are developed to protect against all strains of COVID-19, and I'm really not sure that strains is the appropriate word. The virus is evolving, as all viruses do. But the information that we have, the best information and the most up-to-date information that we have is that, at least in terms of the Moderna and Pfizer vaccines, is that they protect against COVID-19 in general.
Long term, I guess, do we know the effects there, and how long will it last? Because I guess that's if we had a crystal ball,
Well, the anticipation is that those vaccines should provide some degree of immunity for 6 months. And of course, the vaccines, even during the trial phase, nobody has had any of those vaccines for more than 6 months. So I think as time moves on, it would not surprise me at all for us to learn that those vaccines provide immunity for a period longer than 6 months. But we don't know that yet because we haven't had enough time to learn it. So right now, the advice is those vaccines provide a degree of immunity for 6 months, and if immunity begins to wane after 6 months, then a COVID-19 vaccine may may be something that we see on a regular basis.
Yeah, and so both of these, Moderna and Pfizer, will require 2 doses?
Correct. There are upwards of 200 COVID-19 vaccines in some stage of development. The Pfizer and Moderna happen to be the first two to finish clinical trials and, at least in the case of Pfizer, receive emergency authorization. We expect that for Moderna in a matter of hours, if not days. So those are just the first 2 of many, and we anticipate millions of doses rapidly deployed over the next few weeks and months, and more vaccines coming online.
And I know in talks, you were mentioned the drive-through setup. One of the things to consider is, I guess, allergic reactions, or anytime somebody is administered a vaccine, they are urged and suggested that they stick around for a while in case they develop an allergic reaction. But this one, I believe it's 30 minutes they need to...
So Pfizer has come out with a fact sheet. Now, again, this is the Pfizer vaccine. The Moderna vaccine, of course, as I said, it has not formally received the emergency authorization. So I anticipate we'll have a fact sheet for the Moderna vaccine over the weekend. So I can't speak to that yet because it hasn't been made available. For the Pfizer vaccine, and this is strictly unique to the Pfizer vaccine, it suggests that individuals that receive the vaccine be monitored for 15 minutes. If that individual has had an adverse reaction to any of the ingredients in the Pfizer vaccine, then they should be observed for 30 minutes. So, getting back to the drive-through model, we will set up our drive-through event with ample parking for folks who have been vaccinated. So you just get the shot, we'll have a spot for you to park and wait for 15 minutes or 30 minutes if appropriate, to make sure that you don't have any adverse reactions. And if you do, we'll have an ambulance on scene to treat you.
Mm-hmm. And so right now, somebody was asking whether is the plan for the city the drive-through scenario, or can they go to a clinic, can they go to the health department, or is it going to be, at this point, the plan for a drive-through only?
Well, that is our plan to rapidly, the Garland Health Department's plan to rapidly administer vaccines. Now, as Diana mentioned earlier, I think at last count there were 40 some odd providers that were either approved or in the process to receive vaccines. So, those different providers, they'll have their own plan to administer vaccines. The drive-through model is strictly for the Garland Health Department, and we've found that is the fastest way to distribute vaccines and, of course, maintain social distancing and prevent the spread of COVID while people are standing in line. We don't want long lines these days.
Yes, exactly. Which brings us to another question that somebody asked, after I get the vaccine, do I still have to wear a mask? Everybody wants to get rid of their mask, we understand, but...
That's the $1 million
yes.
question. Yes.
But, I think...
The answer is yes. Yes. The preventative measures, even for folks that have been vaccinated, those preventative measures, including wearing a mask, social distancing, and the like, we're going to ask that the public continue to adhere to those measures, at least for a period of time, until the public is adequately vaccinated, and we've all heard this term herd immunity, and in public health that's a term we've used for decades, right? And so, but until we reach that herd immunity level, and nobody really knows where that is. I can't tell you what day or even what month we'll reach that, but it's one of those things that when we get there we'll know it. We just don't know when we'll get there. We will ask people to continue to take the preventative measures, wear masks, social distance, and the like. You mentioned my crystal ball earlier. I would like to think that with a rapid vaccine distribution, perhaps for Independence Day of 2021, maybe we can burn our masks rather than have fireworks.
There we go. Yeah, sounds like a plan to me. And there's nothing wrong with continuing to wash your hands periodically, and the flu's still out there, common cold's still out there, so
Well, I was just about to talk about the flu. Of course, we actually have a pandemic every year, and that's seasonal flu. I was talking with our city care clinic, so that's a healthcare provider strictly for city employees. They've not seen one flu case this year.
wow.
And do you know why?
Yeah,
Because of social distancing, because of masks, because of the personal protective measures. Those protect you from not only COVID-19, but really any respiratory virus. So I guess a silver lining in these protective measures that are sometimes burdensome, at least a silver lining, is that they're preventing the spread of flu.
they're working.
Yes, they are.
Yeah, and for a while at least, as you mentioned, we need to continue to practice those measures. All right, so will the vaccine prevent contracting the virus or minimizing the symptoms?
Gosh, you got a lot of good questions. So I guess to answer that question, you need to distinguish between infection and disease. So infection occurs when you breathe a droplet containing COVID-19 into your lungs. So that's considered infection. And of course, a vaccine won't prevent that. It won't prevent you from breathing a virus particle into your lungs. What the vaccine prevents is that infection from growing into a disease. So you will still be exposed to COVID-19, of course. The vaccine just gives your body a head start to be able to immediately begin to fight off that virus. You may feel COVID-19-like symptoms, but ideally, if you've been vaccinated, you either won't feel any symptoms at all, or you will only have mild symptoms. The vaccine is intended to guard against the full-blown disease. And that kind of leads into the idea of why we're continuing to ask people to wear face masks, because the fact of the matter is we don't know. The virus and the vaccines have not been around long enough to know how well they allow people to immediately fight off that infection. I mean, you may have a very, very mild infection if you're vaccinated, which is good, yet you may be able to spread the disease to others. That's why we're asking people to continue to mask and social distance. We won't know the answer to those questions for a few months.
So I guess one of the questions is then, should I wait a few months perhaps, see how others are reacting to the vaccine?
All of the information that we have is that the vaccines are safe and effective. And I would encourage everyone, when you're eligible for a vaccine, I would encourage you to get a vaccine as quickly as possible. I'm in my mid-40s. I'm healthy. I don't expect to be eligible for a vaccine at least for a few months. But as soon as I'm eligible, I intend to get the vaccine.
Yeah, you all don't have any problems, getting them.
No.
No hesitation.
Not at all.
To get it. And if you've had COVID, should I get it?
Yeah, there is the guidance says that yes, you can get the vaccine. There is some guidance early on that folks with COVID, and by the way, I've had COVID in early November, so I'm a COVID survivor. I have a degree of immunity for up to 3 months, so there's some early guidance that says perhaps those folks that have had COVID within the prior 3 months, maybe they should defer their vaccine so that individuals without any immunity can have the vaccine instead. But in terms of the vaccine being safe, yes, it's safe for individuals who've had COVID, and it's safe for individuals who have not had COVID.
What about children?
Children, that is still being studied. So the vaccines, their trials were for adults. The Pfizer vaccine was 16 years and older. They are studying, they're ensuring, I guess the best way to say it is there are currently trials underway to assess the safety of the vaccines on kiddos. Those are not complete. So the two vaccines that we've been talking about, the Pfizer vaccine is approved for anyone 16 years and older, and the Moderna vaccine is approved for anyone 18 years and older. And of course, as I said, the safety trials to ensure that those vaccines are safe for kiddos, those are underway. I can't give you a time or a date on when we expect that information to come out, but I would anticipate within the next few months we'll have safety information for children.
Yes, and we should point out, because somebody's asking, where they can get more information and links or what have you. We will display and give you links that we have on our website already to hopefully answer some of your questions. And at the end of this Facebook Live, we'll provide that to you. So just stand by for that information. I want to look at some of the other questions that are coming up right now. John is asking, there are apparently several manufacturers making different vaccines. Are any of the particular vaccines better than others? How exactly do they differ in action or effectiveness?
Gosh. These are wonderful questions.
Yeah.
So yes, there are several manufacturers making vaccines. It's my understanding that the Pfizer and the Moderna vaccine, and Diana can correct me if I'm wrong, but it's my understanding that in the clinical trials, they've shown more than 90% efficacy. So
95%.
So those two vaccines seem to have similar levels of efficacy in terms of preventing COVID-19. Now, as we see more vaccines roll out, no doubt some vaccines will be more effective than others. And that information, we don't have it at the moment. We'll just have to wait until those vaccines receive emergency authorization, and we'll know which ones have a higher rate of efficacy than the other. But
And folks who get the first dose, 3 weeks later or so, they're supposed to get the second one. Do they go? Dorothy's asking whether they will be able to get the second dose at the same place that they got the first one.
Yeah, the answer is yes. That is the expectation. And now, of course, the time frame for the second dose, the booster dose, differs between manufacturer.
Yep.
So, for Pfizer, the second dose, the booster dose, is 21 days. Now, if you don't get it, ideally it's 17 to 23 days. But if you miss that window, you can still get the second dose. Even if you show up 30 days or 45 days, you can still get the second dose. What I do need to point out is that the doses aren't interchangeable. So if your first dose is Pfizer, your second dose has to be Pfizer. It can't be Moderna or any of the others. You have to finish with what you start out with. And to address the second part of that question, there's no reason that I'm aware of that individuals couldn't go to a different provider for their first and second dose, so long as they get the same type of vaccine. Now, the individuals that are vaccinated, they're going to get a card as sort of proof of their first round of vaccine. It'll have the date of vaccination and the type of vaccine that they received. So if somebody receives a vaccine, their first vaccine from us, they'll have that card that they can take to a local pharmacy or a doctor's office for the second dose. That card contains the information that a provider would need to give them the appropriate second dose.
So if, let's just say, because somebody might be thinking it, that okay, if my elderly sick grandmother qualifies for the Pfizer one, and it's Pfizer obviously is not 100%, then maybe after she's done with that, I'll take her and get the Moderna one as well, and then she really will be covered. Not a good idea.
No, ideally you want 2 doses of the same vaccine, and that provides adequate coverage. And we want to save the other doses for the folks with no immunity, the other elderly individuals or individuals at high risk. So yes, one series of vaccine is sufficient. But you want to make sure and get that second dose for both Pfizer and Moderna. Now, I will say that there is a vaccine under development. We don't really know if or when it will receive an emergency use authorization, but a Johnson & Johnson vaccine that's 1 dose. But as I said, we're probably still several weeks, if not longer, away from seeing that vaccine be made available to the public. And we really don't know the level of efficacy. I've not seen any information on how effective that is, how it compares to Pfizer or Moderna.
Is Garland, I guess, equipped to store the Pfizer one? As you mentioned earlier, it requires
It's difficult, logistically, it's difficult to administer the Pfizer vaccine. The answer is yes. The shipping containers that the Pfizer vaccines come to us in, they allow for storage up to 30 days. provided that we replenish the dry ice once every 5 days. So we don't, the Garland Health Department doesn't own an ultra-cold refrigerator, freezer. We don't own an ultra-cold freezer because no other vaccine requires that type of storage. But the good news is the containers that the Pfizer vaccines come in can safely store those vaccines for up to 30 days.
All right. Garland, with almost, 250,000 people, does the city apply and ask for a certain number of vaccines, to cover everyone, or how does that work? How are they allocated? I guess we're a bigger city than perhaps other cities here in North Texas, and so how is it determined? And do you ask for a specific number, or how does that work?
Good question. And do you want to?
I basically went through the application process to get approval in late October, early November, and they get pretty in-depth. You're basically basing your numbers off people that you've seen in your clinic before, so they ask specifics of different groups and how many you saw last year specifically, and you just do your best to answer those and estimate those numbers to get an accurate account of how many people that you will see in your clinic under those groups. It got pretty in-depth, and it wasn't easy, but we got through it, and we got approved in late November. And so we're approved as a provider, and we're also approved as a health department to help assist these other providers to get through the enrollment process.
And can you specify, though, a certain number? Hey, we need X amount because we have X number of, the population and what have you, or is it just what they give you?
You base it off the number of people you've seen through your clinic, and so we just did our best to pull those numbers up for the previous year.
But at the moment, I mean, we don't have a choice in the number of vaccines that we get. We were allocated 900.
We're allocated 900, and that's based off the numbers that we submitted for during the application process.
And you could hear a word that you're getting even more tomorrow or the next week, or perhaps it's just, again, we mentioned things just change.
Well, what we do know is that the faster, and we said this earlier, the faster that we administer those 900 doses, the faster we'll get more doses from the state. I mean, you prove yourself. In other words, you prove that you can safely and quickly administer the vaccine, and you get more of it. So we want to get those 900 doses administered as quickly as possible once we actually receive the vaccine.
Yeah, and for folks just joining us now, as we mentioned, we just got word that we are accepting 900 of the doses from the Moderna vaccine, and hopefully we'll get them next week, perhaps, maybe. Hopefully. So yeah. So as soon as those come in, they will be administered, and hopefully we'll get more and kind of get that going. We'll get Pfizer and what have you. And so things are looking like the city of Garland is starting to get those. The plan is in place already for how we will be administering it, and a lot of the I guess decisions on how that's happening and where and what have you. You're basing it on CDC guidelines, I imagine, and other experts in how to move forward with this process.
Yes, absolutely. We're basing that on CDC guidelines, Department of State Health Services guidelines from the vaccine manufacturer. But for the viewing audience out there, I would just like to reassure them that the Garland Health Department, we've been planning on vaccine distribution for what now, 5 or 6 months. I mean, we've known this is coming. So we've been planning this for a very long time. We're working with our emergency management group, working with our fire department, police department, and then the cities of Rowlett and Saxe. There's been an enormous amount of work done by a lot of people to plan for this.
Yeah,
We're ready. We're ready.
We're ready, and yeah, we got a long road ahead as well. So, we got a couple of minutes left. We're not going to cut anybody off if anybody has any further questions. And I don't know if you want to, if anything else we haven't covered that you perhaps want to mention, want to let folks know here in Garland about, this process and what's happening. I mentioned behind the scenes, there's a lot going on and a lot of planning happening here, in preparation for the vaccines and how those will be handled. And we try to we try to update folks again on our website, social media, and let folks know how things will work. And there is a plan in place, and so that is the purpose again of this Facebook Live today. And hopefully we were able and have been able to answer some of those questions that you may have. But yeah, if anything else that perhaps we should let the public know about the vaccine, COVID.
Just keep an eye on the website for the latest information. We'll update it as soon as we know. And to, stay safe, wear your masks, and the vaccines are here. They're coming, and a lot are coming, and it's going to be quick.
Is it too? Am I being too unrealistic to think that perhaps that all of Garland will get vaccinated? Or, obviously, is that a wish of yours?
Well, I don't think it's not unrealistic to say that we are going to make vaccines available to every Garland resident as quickly as possible. Now that's going to be a months-long process. I have no doubt that there are individuals out there that, for whatever reason, they just choose not to be vaccinated. And to those folks, I know that individuals have various concerns for vaccines. I would encourage them to review the information provided by the individual vaccine manufacturers and the CDC. But at the end of the day, it's a personal choice. So no, I don't anticipate every Garland resident getting vaccinated, but I do anticipate vaccines being available for every Garland resident at some point in the near future.
And think of your loved ones too when you're thinking or deciding about getting the vaccine.
Yeah, of course, a vaccine protects an individual. But by extension, and particularly in the middle of the pandemic, if one individual in a household is protected by a vaccine, by extension, that protects your loved ones in the household. It reduces the risk of you catching a virus, bringing it home, and transmitting it to your family. The more people that are vaccinated, it reduces that risk for your friends. Think of all those friends that you've not been able to spend much time with over the last 9 months. Think of your coworkers. Think of your community as a whole. The more people that are vaccinated, the more protection is provided to our society at large. So not only is it good at the individual level, it's good at the societal level.
Another question here on Facebook. How will you make sure you have enough vaccines for the second dose?
So the vaccine distribution plan, the 900 doses that we'll get next week are considered first round vaccines. And as part of that distribution process, the state is sort of they know that in the case of Moderna vaccine, they know in 28 days the city of Garland will need another 900 doses, assuming that we give all 900 doses, which we're going to. They'll know in 28 days we need another 900 doses for the second round shot.
All right, and let me see, who else? Somebody else has a question here. In terms of, and we mentioned it earlier already, but some folks asking about, okay, my age group and those tiers, how do I find that out?
Actually, the information that I printed off is there's information both on CDC and the Department of State Health Services webpage. And Saul, we'll have to check after this Facebook Live. We may have a link on our vaccine page already.
And we do it, I don't know if Dan, if we want to just pull it up already anyway, but yeah, if you do want more information, and we have posted more information, garlandtx.gov/COVID vaccine, you'll find the very latest there. We have also included links to the CDC, Pfizer, the FAQs, state resources as well. So if you go there, we have provided other links. And we should mention that we will continue to update that site itself, because again, things will be changing. We'll be adding more information. We'll be adding the Moderna information as well for that vaccine as well. So right now, that's where you can go, garlandtx.gov/COVID vaccine, and you can get the very latest in terms of what you need to know about the COVID-19 vaccine. So I'm looking through here, see if there are any other questions that we perhaps, and if we didn't get to your question, my apologies, but Jason, Diana, I don't know if you want to add anything else, or if you think that we have covered it.
The viewing public has done a great job of asking questions. I can't think of anything that I wanted to talk about that we haven't covered. Diana, can you?
No.
Yeah, and hopefully we covered it, and you all are readily available to answer any questions and from the public. If they want to get a hold of you, of course, all our information on our website as well, garlandtx.gov, for any and all information regarding the different departments, and if you have any questions regarding the vaccine. So we thank you, Jason, Diana, for joining us, and thank you for joining us and asking these questions. And please be careful out there, take care, and be safe. And thank you for joining us for this Facebook Live.